single fiber EMG was one of the most important developments at our institute in Ljubljana too, thanks to the late Professor Jože Trontel. Our next speaker is one of the pioneers of the method, another good friend of Ljubljana. Professor Donald Sanders from Duke University will present the guidance for single fiber EMG, and he also is the first author of the guidelines. Don, please.
Hello, Blaž. Thank you so much. I think we can go directly to the video now, if that's up. I'd like to thank the organizers for their invitation to participate in this virtual session in Ljubljana. I only wish it would have been possible to be there in person. I'm going to be discussing the guidelines for single fiber EMG that were published in a recent issue of Clinical Neurophysiology. These are the topics that are covered in that paper. I'm not going to cover all of these. I particularly want to discuss some of these pitfalls in measuring jitter, both with voluntary activation and electrical stimulation. To begin with, I want to discuss a few technical issues that are discussed in that paper. There are two techniques that are used to measure the interpotential intervals for jitter calculations. The first is the voltage level technique. There's also a peak detection technique. With both of these techniques, the operator sets an acquisition trigger level on a unique portion of one of the spikes of interest to extract the signals from the background activity. Signals are then stored in the equipment, and the operator replays these signals and sets two windows in the voltage level technique. The first voltage level window is set over the rapidly rising phase of the triggering potential, and the second window is set to span the distribution of the non-triggering spikes, and the jitter is measured between the points at which the first spike goes through the first window and the second spike goes through the second window. In the peak detection technique, as mentioned, the operator sets the acquisition level, and the equipment then calculates theoretical peaks of the spikes by extrapolating the rising and the falling phase to a point. This is done for both the triggering and the non-triggering spikes, and the intervals are measured between these two calculated peaks. Jitter is measured as the mean difference between consecutive interpotential intervals, the MCD, which corrects for any trends in the data. Another measurement, the mean sorted difference, corrects for the effect that the velocity recovery function plays if the firing rate is variable. These calculations should have the same value when the firing rate is constant, for example, during stimulation activation. If they differ, the lower of them is used to represent the jitter. How many recordings should be measured during a jitter study? A full study should include recordings from 30 to 40 in plates. So with voluntary activation, that means 15 to 20 pairs. And with stimulation activation, 30 to 40 action potentials. At least 50 discharges should be measured for each recording, and it's a good idea to record more, say up to 100, to allow for editing and exclusion of any noisy signals. Recordings are made through 3 to 4 skin insertions, and it's important to move the electrode after each recording to avoid duplicate recordings from the same muscle fibers. For voluntarily activated studies, the electrode is positioned to record spikes from at least 2 muscle fibers with acceptable amplitude and rise time. And jitter is measured between the spikes. Summated spikes are common in concentric needle electrode recordings. They are best observed when the signals are superimposed, as here, Spikes should only be used for jitter measurements if they meet these criteria. An initial fast rising phase without notches or shoulders. The rising phases should be parallel in all discharges, and the waveforms should be the same for all discharges. Spikes that meet these criteria are referred to as apparent single fiber action potentials because they have the same appearance as signals recorded with a single fiber electrode. These are unacceptable signals recorded with a concentric needle electrode. These first two spikes are okay. They meet all of the criteria, and obviously this slow hump here does not. On this signal, the rising phase has a shoulder, and in this signal, the shape is not constant in consecutive discharges. These are some other unacceptable spikes recorded with concentric needle electrode. The first spike here is okay, but this spike is clearly composed from signals from at least two muscle fibers. There's a shoulder on the later discharges, and these are not parallel. And there's quite a bit of variability here in the amplitude of the spikes. This spike is also okay, meets all of the criteria, but there is on the second spike a subtle shoulder in some of the discharges, and the rising phases are not parallel, and the amplitude varies considerably. So this signal should not be used for measuring jitter. Another interesting artifact is the triangular after potential. This is a positive discharge that follows the main body of the signal. It begins initially close to the signal and then progressively moves out with discharges and then ultimately disappears. Here in the superimposed mode, these signals can be seen. They must not be used to measure jitter. Here we see the different ways that intervals are measured by the voltage level and peak detection technique on riding signals being those in which the second spike begins before the first spike returns to baseline. The yellow line here represents the distribution of the intervals measured with the voltage level technique, which obviously reflects not only the neuromuscular jitter, but also the effect of the variability in the vertical position of the signals. With the peak detection technique, the distribution is less and is not affected by the riding. Thus, if the voltage level technique is used, riding signals such as this should not be measured. They can be measured using the peak detection technique. Here's some other pitfalls in measuring jitter. Repeated measurements from the same muscle fiber. As mentioned, this can be avoided by moving the electrode adequately from recording to make sure that you're not measuring from the same muscle fibers. Increased jitter is found not only in primary disorders of neuromuscular transmission, such as myasthenia gravis, but also in neuropathy and myopathy. These conditions should be excluded by routine EMG of the tested muscle or other means, especially if the jitter measurement reveals complex signals or increased jitter is unexpected. Do not include recordings with jitter less than 5 microseconds. This is too low to be due to neuromuscular transmission and is typically due to phenomena such as a split fiber. Results of the study should be interpreted in light of the clinical findings. Borderline results should be interpreted with great caution. Patients with even mild myasthenia gravis should have significantly increased jitter, especially if weak muscles are tested. And it's important to measure jitter in muscles that are involved based on clinical observations. For voluntary signals with 3 or 4 spikes, we accept jitter from all interpotential intervals if they're all are normal or if only one is abnormal. If jitter is abnormal in more than one interpotential interval in such recordings, we accept only the abnormal interval with the lowest jitter value in order to avoid an excessive contribution from phenomena such as a reinnervated motor unit. This is uncommonly an issue in concentric needle electrode recordings, since the individual spikes in such recordings rarely fulfill the apparent single fiber action potential acceptance criteria. In multi-spike signals recorded during voluntary activation, jitter can be measured between one triggering spike and each of the other spikes. However, jitter in the triggering spike will influence all the other measurements, and increased jitter in this spike will increase the jitter in all the other pairs. To minimize the effect, the sum of the jitter in the different pairs can be calculated, and the spike with the least sum jitter is used as the trigger. In this example here, the first spike is used as the trigger, and the jitter is measured between spikes 1 and 2 and spikes 1 and 3. Sum of the jitter between these two measurements is then calculated. The same thing is done using the other spikes as the trigger. Here, for example, the second spike is used, and the jitter is measured between spike number 2 and spike number 1, and then between spike 2 and spike 3. And the sum of the jitter is recorded. Same with the third spike here. The jitter sums for the second and third spikes are greater than the sum jitter for the first spike. Thus, the values calculated when the first spike is used as a trigger are accepted. Some equipment can make this calculation automatically. Because of the effects of the velocity recovery function, jitter is artifactually increased if the firing rate is variable. This is inevitable during voluntary activation and is detected if the MSD is less than the MCD. In such cases, the MSD is used to represent the jitter. The velocity recovery function is more apparent when the intervals are long, and thus one should only use recordings with an interpotential interval less than 4 milliseconds. If there is blocking, the activation rate of the muscle fiber is irregular. This will be discussed later. Because of the velocity recovery function, the intervals at the beginning of a train of stimulated responses progressively shortens. This also occurs after a change in stimulation rate, and this will be discussed later. F waves also introduce a slight amount of variability in the intervals, as will be discussed later. Blocking itself introduces an irregular firing rate, and this may artifactually increase the calculated jitter. To reduce this effect, it's recommended that jitter values exceeding 150 microseconds be set to 150 microseconds when calculating mean jitter for the tested muscle. This slide shows the effect of F waves on the following M wave latency. These are sequential traces during stimulation. Here is a stimulus artifact, M wave, and in some of the traces, F waves are seen as indicated by the circles. Following each F wave, the latency to the M wave is slightly shorter than previously. This is indicated by the red arrows. Here, the interval values are represented by these dots. And again, you can see that the values shorten after each F wave. This can induce a slight bit of variability due to the VRF, and in such cases, the MSD will be less than the MCD and should be used as a jitter for that recording. Jitter is artifactually increased by the VRF during the transition period after stimulation rate is changed and during the initial second after beginning stimulation. Here we see the interpotential intervals during a train of stimulations after a pause and then resumption of a different firing rate. Same here, as a pause, then stimulation at 15 hertz. Pause, stimulation at 20 hertz. Same phenomenon is seen here where stimulation at 10 hertz produces intervals with a tight distribution, and immediately after the stimulation is increased to 20 hertz, the intervals shorten and then become stable again. These changes are due to the velocity recovery function, and jitter measured over these transition periods would be artifactually increased. Thus, spikes elicited during the initial second after beginning stimulation or after a rate change should not be included in the jitter calculation. The phenomenon of bimodal jitter or flip-flop is occasionally seen in normal muscle. It produces a distinctive characteristic sound, and there's a bimodal distribution of the interpotential interval values. The interval between the triggering and the non-triggering potential have two preferential positions, as can be recognized by the two distributions in the sequential and in the non-sequential histogram of the intervals. Jitter can be measured at one of the positions, but not both, since they're both coming from the same neuromuscular junction. And particular care must be taken not to measure jitter across the distribution. The most egregious pitfall seen during stimulation jitter studies is liminal or threshold stimulation. This is demonstrated here on this slide. The column to the left, stimuli are being applied with barely threshold stimulation. Some stimuli produce no response. Some produce a response in one action potential, but not the other. And the calculated jitter is seen here. The equipment report the high percentage of blocking of both of the spikes. The stimulus intensity was slightly increased, and now we see responses in both spikes to all stimuli. There's no calculated blocking, and the calculated jitter is much decreased. Liminal stimulation can only be recognized by the operator at the time of recording. To assure that stimulus is suprathreshold, the intensity should be increased with every recording to see if the jitter decreases. Increasing the stimulus intensity to do this frequently recruits new spikes, and they must also be assessed for adequate stimulus intensity. Here we see the so-called axon reflex, which is not truly a reflex. This can be seen when slightly increasing the stimulus intensity causes the action potential to jump to a shorter latency. Here's the presumptive explanation for this. Here's the axon and the terminal branch that goes to the muscle fiber we're recording from. Weak stimulation causes retrograde conduction up to the branch point and back down to the muscle fiber we're recording from. Increasing the stimulus intensity causes direct activation of the terminal axon and a response with shorter latency. As with flip-flop, it's important not to measure jitter across these two positions. Jitter can be measured at the position with the shorter latency. Stimulated potential analysis using concentric needle electrodes, or SPACE, SPACE, is a technique for estimating jitter in children developed by Matthew Pitt. The orbicularis oculi muscle is usually assessed to evaluate possible congenital myasthenia, and its technique is performed without sedation. The skin is anesthetized at the points where the two electrodes will be inserted. A small facial needle is used to record from the orbicularis oculi, and a monopolar needle is inserted near the zygomatic branch of the facial nerve. Spikes in the signals are detected with a peak detection algorithm, and jitter is measured from at least 20 repetitions of each signal, and at least 10 signals are analyzed. Normative values for this have been determined using the E-norm technique developed by Joe Jabry. Well, what does the future hold for single fiber EMG? Signal analysis techniques should be developed to automatically evaluate the quality of recorded signals and thus reduce the operator time necessary to assure the quality of the signals for jitter analysis. And it would be great if disposable, reasonably priced single fiber EMG electrodes became available to permit recordings consistent with the original jitter analysis technique. I want to give thanks to the following authors who contributed to the development of these guidelines: Kimiyoshi Aramura, Sui Liying, Mustafa Irtash, Maria Elena Faruja, Jim Gilchrist, Joao Koyumjian, Luca Padua, Matthew Pitt, and of course, Eric Stahlberg. Thank you for your attention, and I think we have time for some questions.
Thank you, Don. We do have one question now. So the question is, could a change in jiggle parameter, single fiber EMG, justify an atypical triggering potential? How can we differentiate a jiggle abnormalities from an atypical triggering potential?
Well, jiggle is a term used to describe the overall variability of a motor unit potential. And it includes not just the variability in the time relationships, but also the variability in the amplitude of the components in the motor unit potential. And it was initially used to measure signals recorded with a concentric needle rather than a single fiber EMG electrode. When we're talking about measuring the jitter between individual components with a single fiber electrode or with a concentric needle using the apparent single fiber action potential criteria, we're looking solely at the variability in the time relationships among these components. With jiggle, it's hard to say which individual component you're triggering on. And that would vary a lot depending upon the complexity of the motor unit potential. But I think the main difference is that with one, you're looking at individual components, and the other, you're looking at the overall motor unit potential. I'm not sure if that answers the question or not.
Thank you. We're waiting if there will be any more questions, but I think that so far it's been just one question. We are perfect on time. I think I can thank you very much, Don, for being with us again after a few years. Again, hoping to see you in person in Ljubljana sometime soon.
Yes.
Thanks for joining us from the States.
Right.